Brian or your guests could clarify that to us. Many of us are having this question during this press conference. Thank you very much.
Yeah, but Anna Maria can clarify. I think there's some confusion as to whether the hydroxychloroquine arm is suspended.
I apologize for the confusion, so I will repeat again. We promise that on the basis of the recommendation of our executive group for the trial, we will do 3 things. Number 1, to review the evidence, and we post that in the website of WHO, a review of the evidence by the Cochrane collaboration that suggested, the review suggested that there was no apparent beneficial effect of hydroxychloroquine. 2, there was a press release by the UK recovery trial on the findings of hydroxychloroquine that suggested that there was no beneficial effect on mortality, on the duration of hospital stay, and on the need for ventilation. Third, we say we were going to look into our own data to see if there was evidence that it suggested beneficial effect. So we have completed these 3 things. We have a discussion with our executive group and all the PIs, or the principal investigators of the trial that finished just 10 minutes ago. And on the basis of this evidence, we are going to proceed. It's not automatic. We are going to proceed to consider the modifications on the protocol for the WHO Solidarity trial. And apologies, I was not clear the first time.
Thank you very much for this clarification, Dr. Henao. Now we will go to Business Insider. We have Anna with us. Anna?
Hi, can you hear me?
Yes, very well.
Great. I just would like some insight on second lockdowns. We're seeing, I know you don't necessarily want to call it a lockdown, however you term it, we're seeing spikes in cases across the US and places around the world. And some of the strategies are to go back into lockdown, or some of the threats have been that. I would like to hear kind of your thoughts on how that works as a public health strategy the second time around. Thank you.
So thanks for the question. This is it's an important one. I think we've been trying to articulate that the approach and the interventions that need to be taken by countries will depend on the situation that they're in. It will depend on how the virus is circulating, how efficiently it is, the intensity of it, and what are the systems in place to be able to detect the cases, to isolate cases, to care for those cases depending on their severity, to quarantine contacts, to empower the communities, and have an all-of-government approach. And in many situations, we have seen countries have success in suppressing transmission, where we've seen their epi curves go down and transmission go to a low level or even stop in some cases. But there is always the possibility that the virus can resurge, and there are opportunities for the virus to be able to take off again. And if there is a situation where the virus does resurge, then certain interventions may need to be put in place. What we're hopeful for, though, is the decisions that are taken to adjust these measures, whether to lift them or whether to put them in place again, is done in a data-driven way, and it's done in a way that meets the needs to suppress transmission. It doesn't have to be all or nothing, and in fact shouldn't be. It should look at which are the measures that need to be in place and where, and in a temporary nature. So the fundamental things of hand hygiene and respiratory etiquette, physical distancing, using a mask when you're in community transmission and you can't adhere to physical distancing, all of these measures continually need to be put in place in addition to active case finding, caring for cases, and contact tracing. So it's a long answer because it depends on the situation. Governments need to look at the data that they have. They need to look at which measures can be implemented where, and do that in a slow and in a staggered way depending on where the need is. But it is certainly possible that countries will need to implement measures again, as we've seen in a number of countries now, but we are hopeful that those could be temporary.
And if I could add, if we look at the experience of countries that have avoided I mean, the so-called lockdowns are stay-at-home orders, travel restrictions, extreme public health and social measures, can be varied in their footprint, in their duration and in their intensity. The type, how long and where these things are implemented. And governments have choices. The more blunt your surveillance system is, the less sensitive your surveillance system is, the more blunt your response measures have to be. If you can't see very well in the dark, then you don't know where to apply the measure against the virus, if you can't see it. And I'm sorry for being so simplistic, but governments need to be working on their surveillance. They need to know where the virus is. If you know where the virus is, if you know who's getting it, if you know the situations in which it's been transmitted, if you do case and cluster investigations, and you can understand in your communities and societies what are the specific situations and contexts in which the disease is amplifying and spreading, then you can apply measures that are much more sophisticated. You can apply them at a lower geographic level. You don't have to do the measures everywhere. You can do them in one county or in one community. You don't have to do them forever, because you can raise those measures relatively quickly because you have a surveillance system to see if something is going wrong. So I do think we need to move towards a more sophisticated analysis of, is it no lockdown, lockdown? We need to move into a more smooth, more modulated approach, where our surveillance should drive the measures that we take. And public health and science should be able to advise competent authorities to modulate the measures that need to be taken at any given time. None of that is possible if you don't have surveillance, tracing, testing, and the ability to know where the virus is within your community or society at a given moment. If you don't have those answers, then your responses necessarily become more and more blunt, less and less precise, and that's when we see large-scale lockdowns that have such an impact on social and economic life.
Many thanks, Dr. Ryan. Now we will try to go back to Jim, if we have Jim. Jim?
Yes, I'm very sorry, Terry.
No, it's okay. Please go ahead.
I was just wondering if there is any new science or any new information on the behavior of the virus that causes COVID-19. Have we seen any advances in knowing how it spreads, the super spreading events that it seems to have? Is there any new science on the behavior to help us get around the ability to rein this thing in?
So thanks, Jim. It's a great question. So we're learning about this virus every day. We're learning about how this virus behaves and its characteristics. And, there are really incredible studies that are being published every day. Really grateful for these detailed epidemiologic investigations, household transmission studies, cluster investigations, studies in healthcare facilities. I could go on and on. And these are unfortunate in a pandemic like this, there are these opportunities to learn about how these viruses behave, and we have really good researchers all over the world that are communicating with us directly and are publishing these results. We have scientists that are following the virus itself. And so there are full genome sequences that are being made available publicly. There's more than 40,000 viruses, 40,000 full genome sequences that are available, in which we are looking to see if there are any changes in the virus. We do see normal changes, which is expected with an RNA virus. And this unprecedented reporting of these viruses is allowing us to look at these viruses in real time. Secondly, we're seeing very detailed cluster investigations, as you've heard Mike say, where there are outbreak investigations in either expat dormitories or in gyms and facilities or in wherever we are seeing these super spreading events. And indeed, we are seeing super spreading events in places of worship, in gyms, in long-term living facilities. And these places where the virus can transmit, we can learn a lot from. Who is it transmitting to? In which departments, for example, in a healthcare facility? And that helps us refine our guidance. It helps us refine our ability to break the chains of transmission, to prevent infections, and to work to save lives. So the virus, in terms of what we know about its behavior and how it transmits, is very similar from day one in terms of its respiratory nature and spreading through respiratory droplets. But the super spreading events are worrying because these are opportunities that we can actually work to prevent happening. If we know that they can happen, we can ensure that in facilities where people are in close quarters, we put measures in place to break those chains of transmission before they even have a chance to start. So thanks for that question. We encourage research to continue. We encourage collaborative nature in research and open findings and having researchers communicate with one another and with us. And we know we will learn even more every day.
Many thanks. I have received a couple of texts from journalists who just want to clarify with Ana Maria about hydroxychloroquine. Dr. Henao.
Yes, thank you, Tariq. So I try one third time. The internal evidence from the Solidarity Discovery Trial, the external evidence from the Recovery Trial, and the combined evidence from these large randomized trials bring together suggests that hydroxychloroquine, when compared with the standard of care in the treatment of hospitalized COVID patients, does not result in a reduction of the mortality of those patients. Based on this analysis and on the review of the published evidence, the executive group of the Solidarity/Recovery Trial has met in 2 occasions, and today we met with all the PIs. After deliberation, they have concluded that the hydroxychloroquine arm will be stopped from the Solidarity trial. But I want to emphasize that this does not constitute a WHO policy, that this is not a WHO policy recommendation. This is the results from trials, and that this does not apply to the use of or the evaluation of hydroxychloroquine as post-exposure prophylaxis in patients exposed to COVID. That's a different thing. So this is focused on what we are doing on the Solidarity trial, on randomization for COVID patients, but does not apply outside that, and it doesn't constitute WHO policy. WHO has different processes for developing of guidelines.
Thank you very much, Dr. Henao. We hope now this question has been clarified, and we will take one last question, and then